الله وبركاته. معكم منيرة ربيع. بكمل الحديث عن الأوتوإميون ديزيز. بتكلم تحديدا عن الهايبرسنسيتيفيتي. الموضوع جدا بسيط، وغالبا أسئلة البروجرس اللي تخصها الموضوع تكون بسيطة ومباشرة. خذوا الفيديو كمراجعة سريعة، وببتدي بالتعريف of hypersensitivity reactions, which are exaggerated immune response against harmless molecules that lead to tissue damage. We have mainly 4 types of hypersensitivity. To remember them: A, B, C, and D. A for anaphylactic and atopic, which is type 1. B for antibody mediated, which is type 2. C for immune complex, which is type 3. D for delayed, which is type 4. Type 1, 2, and 3 are all antibody mediated, while the last type is T-cell mediated. Starting with type 1 hypersensitivity, which is anaphylactic and atopic, and there is 2 phases. The first phase, which is early phase, which will happen within minutes. There will be cross-link between the antigen and preformed immunoglobulin E on mast cell, and that will lead to immediate degranulation and release of histamine and tryptase. The second phase, which is late, will happen within hours. There will be release of chemokine and cytokines from mast cell, and that will lead to inflammation and tissue damage. The most common example of type 1 hypersensitivity is anaphylaxis or allergies against food or drug. We can use a skin test or blood test for allergen-specific immunoglobulin E. هذا النوع من الهايبرسنسيتيفيتي يعتمد mainly on immunoglobulin E، عشان كذا نقدر نسميه immunoglobulin E mediated hypersensitivity. Moving to type 2 hypersensitivity, there will be antibody bind to cell surface antigen, and there is 3 mechanisms: cellular distraction, inflammation, and cellular dysfunction. Regarding to the first mechanism, which is cellular distraction, the cell will be coated by antibody, and that will lead to phagocytosis and or activation of complement system or natural killer cell killing. The examples: autoimmune hemolytic anemia, immune thrombocytopenia, transfusion reaction, or hemolytic disease of a newborn. The second mechanism, which is inflammation, there will be binding of antibody to cell surface, and that will lead to activation of complement system and Fc receptor mediated inflammation. The most common example of type 2 hypersensitivity in case of inflammation are Guillain-Barré syndrome, rheumatic fever, hyperacute transplant rejection. The last mechanism, which is cellular dysfunction, there will be antibody, and this antibody will bind to cell surface receptor, which will lead to abnormal blockage, like in case of myasthenia gravis, or activation, like in case of the Graves' disease of downstream process. And the third example of type 2 hypersensitivity is pemphigus vulgaris. We can use direct or indirect comp test to detect the antibody. Moving to type 3 hypersensitivity, there will be antigen-antibody complex, which will activate the complement, and these complements will attract the neutrophil, and the neutrophil would release some lysosomal enzyme. In this type of hypersensitivity, there will be systemic or local disease. One example of systemic disease is serum sickness. There will be formation of antibody-antigen complex and deposition in tissue, and then complement activation, and then inflammation and tissue damage. The example of a local one is Arthur's reaction. This type of disease, there will be edema, necrosis, and activation of complement. Other examples of type 3 hypersensitivity are SLE and streptococcal glomerulonephritis. The last type, which is type 4 hypersensitivity, there will be 2 mechanisms, and each of these mechanisms involve T-cell. It might be direct cell cytotoxicity. There will be CD8 or cytotoxic T-cell or killer T-cell, which will kill the target cell. And inflammatory reaction, there will be CD4 T-cell or helper T-cell. It will recognize the antigen and release inflammation-inducing cytokines. The most common example of type 4 hypersensitivity is contact dermatitis. We can use tuberculin test or PBD for tuberculosis infection or patch test to know the cause of contact dermatitis. This slide is a summary for what I talked about if you want to read it. وبكذا نكون وصلنا للنهاية، وأتمنى لكم التوفيق جميعا بإذن الله.